Yesterday, I received a message from a registrar asking, how can I prepare for the SCA? Before we talk about how you prepare for SCA, let's talk about what is it. The SCA is a new exam that's going to replace the RCA. SCA stands for Simulated Consultation Assessment. This new format is an exam that's going to be held in the candidate's local surgery. So it's going to be as if you're doing your own clinic in your surgery, but it's going to be simulated consultation. There will be 12 consultations, a mix of video consultation and telephone consultation. Registrars will be able to take the SCA in the third year of training. Candidates will have 3 minutes of reading time, then 12 minutes to consult the case. The good news about SCA is that it's going to be standardized. Candidates will have role players to consult, and they're not going to have to look for cases as you're doing for the RCA. So there will be more standardized approach with calibrated role players. My understanding is that examiners will assess the consultation at a later date. So when you're consulting the simulated patient or the parent or the relative, then it will be only you and the simulated role player, so that you won't have to deal with examiners. What skills do you need to pass the SCA? To pass the SCA, you need to demonstrate that you're able to keep patients safe. You're adaptable in treating different types of patients and illnesses. You will need to demonstrate your capabilities at managing risk, managing medical complexity, and medical uncertainty. Candidates will also need to demonstrate appropriate behavior, attitude, and concern in managing patients. The college has not confirmed the date for the new SCA yet, but my guess is probably going to be in November or December. So if you're going to sit SCA, it's very important that you focus on your skills at remote consultation, telephone consultation, and video consultation. It's very important that you're able to communicate clearly over the phone, or if you're doing a video consultation, you're able to assess the patient and build rapport remotely. If you found this video useful, you might want to watch the next video in which I interviewed Dr. Camilla Hawthorne and we talk about the new exam. I hope you found this video useful. Let me know down in the comment section if you have any questions or any suggestions. Take care everybody. Bye bye.